This short video will show you how to build and use a simulation model for performing a peripartum hysterectomy. Print the provided stencils to use as a guide. Arrange each page of the stencil from A through F as shown here. Tape the pieces of paper together and cut out the shapes. Use the stencils to trace out shapes onto felt fabric. Next, fold the uterus shape in half. You will sew along the edges to close the uterus. Keep the bottom end of the uterus open for stuffing. Fill the uterus shape with stuffing until it is completely full and almost bulging. Next, fold the ovary shape in half. You will do the same to the other ovary shape. You will sew along the edges, leaving some space for stuffing. Once you have placed some stuffing in, you can then finish sewing the edges closed. Next, the fallopian tubes. Fold the shape in half and, keeping the fimbriae side open, sew along the sides of the tube. Next, for the uterine arteries, you'll need 2 long pink balloons. Fill them with just enough water without expanding the balloon. Tie off the end at the midpoint, leaving around 7 inches. Cut off the excess balloon. For the bladder shape, color in the extensions with red marker to represent the round ligaments. Now that you have all the organ shapes, take a sheet of press and seal food wrap with the sticky side up. This will represent the overlying peritoneum. Place the organs on top of the sheet. You will have the uterus in the middle, the bladder shape on top of the lower uterine segment, the uterine arteries up on each side of the uterus, 2 fallopian tubes at the cornua of the uterus, and ovaries on each side as well. A second sheet of food wrap will be placed on top to surround the surface of each shape. Once the second sheet of food wrap has been placed on top, make sure there is a tight seal around each organ. Then you will trim the food wrap, leaving around 3 to 4 inches from the edges of the organs. And this is the completed model. In this part of the video, we will show you how to use the model to perform a peripartum hysterectomy. First, stabilize the model using a platform or secure it onto a surface with the model propped upright. Make sure you have all the necessary surgical tools before beginning. First, identify the round ligaments to be clamped and divided. Use 2 Kelly clamps with the tips pointed toward each other. The tissue between the clamps is divided using Mayo scissors. One side will be toward the peritoneum that you've released, and the other side you will hold on to. Then you will suture ligate with a Heaney tie. You will do this to the other round ligament on the other side as well. Now, using pickups with teeth, separate down the uterovesical reflection. Now dissect down the bladder. You can now protect the bladder with a bladder blade. Now, using your finger, feel for a window in the broad ligament between the uteroovarian ligament and the uterus. Cut a 2 to 3 centimeter incision large enough to poke your finger through. In reality, you would use a bovie to create the window, but for the purpose of simulation, we are using scissors here. Now use 2 curved Kelly clamps and double clamp the fallopian tube and the uteroovarian ligament. Cut between the clamps. Then suture ligate the pedicle with a Heaney stitch, as shown here. Once you've divided the utero-ovarian ligament and fallopian tube, you can proceed to dissect open the anterior leaf and posterior leaf of the broad ligament. Palpate and identify the uterine artery. Then start skeletonizing the uterine artery. Use a Heaney clamp to grasp the uterine artery, as shown here. To begin dividing the uterine artery, place a straight coker for back bleeding about 45 to 90 degrees above the Heaney clamp, as shown here. Use curved Mayo scissors to cut between the Heaney and coker clamps, leaving tissue on the Heaney. Then suture ligate the pedicle as shown here. Using a curved Heaney clamp, clamp the uterine artery downwards, like so. Then dissect down the uterine artery. To suture ligate, take a suture and place your needle right at the Heaney clamp, entering medially from anterior to posterior, like so. After both uterine arteries are divided, proceed to palpate for the cervix. Push the bladder down further at midline, sliding off the cervix. Use curved clamps to clamp down on each side. Then cut the uterus above both clamps. You are now left with a vaginal cuff. For cuff closure, place a figure of 8 stitch at the midline of the cuff. Then proceed to suture ligate off your clamps to close each side of the vaginal cuff. Place your suture needle posterior and come out underneath the clamp. Tie your knot to cinch down the side of the vaginal cuff. For future directions, we could work on creating a surface or platform for stabilizing and holding the model in proper position. Repeat the process on the other side of the vaginal cuff. Now you have completed a supracervical hysterectomy. Here is your vaginal cuff from the transected lower uterine segment. You have a figure 8 stitch in the middle and a Heaney stitch on each side of the vaginal cuff. This model can be reusable after replacing the uterine artery with new water balloons. And this is how you complete a peripartum hysterectomy.